Hello, everyone. Welcome to Diabetes, Flu, COVID, and You. We will make sure that we give everyone a few seconds to join the attendee room. Thank you guys so much for joining us today. I'm just going to monitor the participants. Make sure we give everybody a chance to join in. Good stuff, good stuff. Wonderful. All right, so we are already at the 4 after the hour. So I want to go ahead and get started to be respectful of our esteemed panelists' time today. We are joined together to talk about diabetes, flu, COVID, and you in partnership with NMQF SHC and the Diabetes Sisters organization. So my name is Kristen Hobbs. I am the Senior Project Manager of Quality Improvement and Equity at NMQF SHC. I am joined by Dr. Deena Adimoolam, who is a board-certified internal medicine, board-certified in internal medicine, diabetes, endocrinology, and metabolism. And Dr. Daniel Fagbuyi, who we call Dr. Dan. He is a distinguished ER doc, biodefense expert, chief medical officer, war veteran, assistant professor, and media expert. Thank you both so much for joining us today. Before we go off to the races with all of the agenda items that we have in our panelist discussion, as well as Q&A, I want to take care of a few housekeeping items. So all attendees are in listen only mode and your videos are turned off. Please place all of your questions in the Q&A box. We certainly encourage respectful communication in the chat box. It's welcome. Please network, please make comments, but we will not be monitoring the chat box for questions. So please put those in the Q&A box. And your transcription should appear at the bottom of your screen. If you do not see it, please activate by pressing the live CC button. It should be at the very bottom of your Zoom panel screen with all of those different buttons. All right, so we'll talk really quickly about NMQF and SHC, Diabetes Sisters, some data, the ACIP recommendations on flu vaccines, including COVID as well. We'll do a panelist discussion and then Q&A. So the National Minority Quality Forum was started in 1998, founded by Dr. Gary Puckrin, really to address health disparities in communities of color using data. That's the crux of what we do. It is the basis for everything that we do. And at the Center for Sustainable Healthcare Quality and Equity, we use that data to build sustainable, healthy communities in every zip code. Communities of color are prioritized, and we focus on quality improvement in clinical education through the lens of health equity. So our president is Dr. Laura Lee Hall, you know me, and we have our brand new Quality Improvement and Equity Project Manager, Chinonso Ukachukwu, and we call her Chinny. She's definitely a fave for the team now. Diabetes Sisters, who I could not have picked a more wonderful organization to partner with, a small team, but such mighty ladies to work with. They are a national nonprofit focused on peer support and education for women living with all types of diabetes. They're led by women living with diabetes and focus on reducing isolation and providing support without judgment, right? When we all love to be be supported without being judged. And they offer in-person and virtual programs through meetups, educational resources, and social media. This is one of those educational resources. The signature programs include the PODS Meetup Program, Leadership Institute for Volunteers, and culturally relevant programs focused on women in underserved populations. So let's talk about some data really quickly. I'm not going to spend too much time on every single data point because this webinar is being recorded, so you can access this at any moment. You can go to the sources and view all of these data for yourself. But I wanted to flag a couple of trends that we see here in flu vaccination by age. So as you can see, between 2010 and 2021, adults 18 years and older, the most vaccinated age group was the population for 65 and over. The trend seems to have followed the same pattern from 2010 all the way to 2021, where you see the dips Every single age group dips, but the 65 plus age range, they remain the same. They remain the most vaccinated. And when we talk about by state in the 2020-21 flu season, Rhode Island was actually the most vaccinated. And then by race and ethnicity, it shouldn't be a surprise. I don't guess it's a surprise to anyone that people of color are least vaccinated from the flu. So this is in general, from 2010 to 2021, those trends remain the same. When you see those dips, they are dipped in drastically amongst communities of color. And in 2020-2021 flu season, white non-Hispanics were vaccinated against the flu at a rate of 55.5%, while Black non-Hispanics were vaccinated at 40.4%, and those identifying as Hispanic were vaccinated at 38.6%. Now let's talk about the flu vaccine in patients living with diabetes. So in 2015, the CDC released data showing that those who were diagnosed with diabetes during that particular flu season, all adults aged 18 and over, in total were vaccinated at a rate of 61.6%. But as you can see, the non-Hispanic Black population was vaccinated at a rate of 51.1%. Again, those individuals living with diabetes. And the Hispanic population was vaccinated at a rate of 53.9%. Now, there's a very different story in 2017. 2017, the morbidity and mortality report that the CDC releases weekly show that adults with a diagnosis of diabetes or pre-diabetes were vaccinated against the flu at a rate of 62.5 versus 56.1% respectively. And then adults with no diagnosed diabetes were the least likely to have had an influenza vaccination at 40.1%. So if the trend went up, right, in 2017, where folks diagnosed with diabetes or pre-diabetes were more vaccinated than those of us who aren't living with that disease, why is this so important? And it's so important because of COVID, right? Diabetes, flu, COVID, and you. This is a lethal combination. One of the things that we were able to glean from the data coming out of those early days and early months in the pandemic was that 40% of all US COVID-19 recorded deaths, out of all of those deaths, those individuals, 40% of them had diabetes as an underlying condition. We certainly know that there can be complications with both diseases. And so we certainly do not want to be in a situation where we don't take preventive measures against both. And so the Advisory Committee on Immunization Practices, which is the ACIP, recommends a routine annual flu vaccination for all individuals aged 6 months and older who do not have contraindications and where vaccine supply is not limited. So if you have any questions about that, please speak with your doctor. Now it's time for some panelist discussion. After we've gone through that data, I'm going to stop sharing my screen so that I can jump in to talking to Dr. Deena and Dr. Dan. Dr. Deena, how are you? I wanted to shoot the first question over to you. And that is really, talking about the ACIP recommendations. So we've seen those recommendations for flu and COVID-19 for individuals living with diabetes. How do you see vaccination uptake played out in your practice, especially among women of color living with diabetes?
So as you know, type 2 diabetes is a risk factor for severe complications of COVID-19, as well as for severe viral infections in general. So we always recommend that our patients living with diabetes are vaccinated against things like COVID-19, the flu, strep pneumococcus, et cetera. So it's important to talk to your doctor about what vaccinations are right for you. We know that, it's very important to be vaccinated in general. When it comes to this population, many patients are also obese, which is another risk factor for developing severe complications of COVID. So for all those reasons, it's extremely important to get vaccinated. Luckily, I have patients that follow me routinely, so I'm able to speak with them about the pros and cons of vaccination in every case, answer their questions whatever, issues they may have, whatever myths they've seen on social media, which has really been one of the biggest barriers to us as physicians, is what's out there in social media. All of a sudden, many people have different opinions on vaccinations, whether they're safe or not safe for themselves, and are getting misinformed by sources that are not necessarily trusted. So I would really recommend, if you do have questions or on the fence about vaccinations, talk to your doctor about what you need to do. We've been doing a lot in terms of the community outreach to try to get into underserved areas to make sure that people are educated about the vaccination, what are the pros and cons, and to make sure that access is granted to whomever wishes to get vaccinated. And I think we've done a really good job in terms of that outreach, especially in the communities of underserved in New York. I can tell you, we've done a lot of community outreach in those areas, and I partnered with Diabetes Sisters in the past as well. And I'm really excited to work with your organization too, talking about COVID-19 and the myths that exist, and just really trying to defeat each of those one by one, because I think that's really been the biggest barrier that we're facing as providers during this pandemic.
Thank you, Dr. Deena. I think you hit on something very important, that those COVID-19 myths and misconceptions are bleeding over into flu vaccinations and routine adult vaccinations. And that's what really we want to message today, is that there's factual evidence-based information out there. And if you have any questions, please talk to your doctor. So Dr. Dan, I wanted to check in with you. So what types of complications, if any, could be seen in diabetic patients that end up sick with flu and or COVID?
Yeah, that's a good question. We see a lot of patients who have diabetes and other medical conditions who may come in, but any patient who has diabetes should be concerned about a couple of things. One, if you get sick, that can worsen your symptoms, and you can go into what we call DKA, or diabetic ketoacidosis, which basically is a state in which your body is breaking down a lot of the body's, substrates, or parts of the body that it's used to make the normal process. And in that whole process, your sugar kind of goes maybe skyrocketed, and then your body now has to deal with this, and it goes into a state of higher acid phase, which can lead to a lot of complications. They may come in with abdominal pain, they may have some vomiting, they may have difficulty breathing, they may develop clots and things like that. But bottom line is they may lose consciousness and can die. So they will require hospitalization, being in the ICU, rapidly trying to lower their sugar and addressing all those issues. We especially worry about this, especially in children also, our adolescents, our teens. So again, trying to prevent any type of infection, and talk less of the viral infections such as flu, COVID, and all the other things that we usually see during these times of the year are important. So what should you be doing? The preventative stuff. So get your vaccine, get your shot, ideally your flu shot and your COVID vaccine shot to protect you against those types of things, and wearing a mask, hand washing, doing all the things to protect you, and following up with your doctor, your endocrinologist, your primary care doctor, and whichever community resources that you use. So that is very important. We don't want to tip each other into a situation where you're unconscious. Emergency medicine services have to show up at your house. Your loved ones are getting sick, and those types of things. So there are lots of complications that can come with that, and there are lots of things that can mask or present just as that, to the point where we sometimes even worry about other things such as appendicitis. How do we go from diabetes to appendicitis? Well, sometimes they present in that so much acute pain that it can actually sometimes mask those things. So you have to keep your sugar in control, and also do the preventative things that you can do.
Excellent. Thank you, Dr. Dan. You touched on those messages, right, of taking those preventive measures. So Dr. Deena, I wanted to ask you one thing you talked about was messaging to underserved populations, right? And we just heard from Dr. Dan about taking preventive measures. So how do you persuade women living with diabetes to be vaccinated? What do those messages actually sound like? Like, what tactics do you use?
For me, the first step is when I have a patient that is not vaccinated, to really dig into why. I think that that's one of the major things is communication, talking to your patients about what exactly is the reason why you don't want to be vaccinated. What are your fears? What are the things that you've heard? And then sort of combating each of those individually. I think that we have a lot of data now. We've been in this pandemic for 2 years plus. And I think there's a lot of information that we have from research suggesting that some of these myths may or may not be something that you need to be, necessarily worried about. So I think that that's, the most important thing that I can recommend, because, there's just too many myths out there. I've heard about myths about fertility. I've heard about myths in relation to, people feeling like they're, I'm so sorry, my son is over here. I've heard myths about people dying. Concern about death related to the vaccination. And for all those reasons, I think, we need to talk to each person individually and just, make sure that we combat their fears one by one, because all of those are unwarranted. I had a lot of patients, I have a 3-year-old, as you can see here. I just brought him home. And I'm really excited, for the prospect of him getting vaccinated as soon as it's available to him. I'm really nervous about what COVID means for him. He's going to school now, trying to protect him, trying to protect his classmates, trying to protect the families and high-risk individuals in the community. All of that is extremely important to me. And I also have a 3-month-old as well. And, just deciding when was I going to be vaccinated with the limited data that I had on the vaccine during pregnancy. I was nervous too, I was fearful, but I delved into the data. I weighed out the pros and cons. What would happen to me if I was pregnant and I got COVID-19? The risk of me dying and having severe complications just being pregnant were much higher than any other concern that I could have at that time. And so I was living in a lot of fear. And I think for me, just being the voice of reason, like the things that I've gone through too, to help people understand that they're why they have these fears, and we have these fears also, and how do we go through that, is the most important thing. So communication, talk to your doctor, talk to someone who understands the vaccine, who understands the science behind this, and trust that, if we decided to get vaccinated, we believe that it's safe, and we would only want to believe that this is safe for you as well.
Absolutely. And no worries. I also have a 3-year-old who literally just turned 3 on Friday. She's only quiet because Coco Melon is on. So I get it.
I actually have the TV on for him, but he still somehow managed to break away and come and say hello to all of you.
That's okay. We say hello to him too.
Okay.
I really do appreciate you bringing the aspect of the pediatric vaccines, only because, with flu, it now being flu season and RSV also kicking up, there's so much worry, I think, that if we don't get the children vaccinated against flu and or COVID, that there will be a larger pandemic that diabetic patients also have to deal with, and other patients living with chronic illnesses. So Dr. Dan, I wanted to ask you, what are the most important factors you want patients living with diabetes to consider when they're making that decision, when they're talking to their doctors, when they're, going through the data, when they're asking these questions? What do you want them to consider?
So thank you. I guess one of the most important things I think to highlight is that diabetes is a risk factor. Any chronic medical condition is a risk factor. But since we're focused on diabetes here, I want to say that in the early studies that we found, 1 out of 4 patients who presented with severe COVID to the emergency department ended up in the ICU had diabetes. So it's a big risk factor. It's not something to take lightly. So that more is a reason. So I would raise the importance of the disease process as a risk factor, and being aware of that you need to do all the things to keep you out of the hospital. So we talked about the preventive measures. We talked about knowing your risk. We talked about talking with your doctor and your endocrinologist, making sure you have your adequate supply for whatever the things that you need, your medicines specifically that your doctor has prescribed for you. I think that is important. And being armed and identifying, getting the right information from the right source when you have questions, to be able to help prevent that. I think it's also important for people who are pre-diabetic to pay attention to this, because we all need to make sure we're getting our normal annual physicals and checkup. So follow up with your doctor, and you should know what pre-diabetes, what that range is in terms of checking what your doctor would check, which is a hemoglobin A1C. It's basically a blood test that actually checks for the amount of hemoglobin, or that protein in your body that helps you carry oxygen in your blood, that's actually attached to a sugar because you've had so much sugar in your body over a period of time. It's a snapshot to see over the past 3 months, this is what we found out. Your sugar is really high, or it's borderline enough that you could be at risk of having diabetes. And they'll give you that number. It's usually somewhere between 5.7 to 6.4. If you're within that range, that's pre-diabetic range. And if you're over that number, you're definitely diabetic. And if you're less than that, you're good, but you should still get your vaccine. So I think those are some of the things that we need to educate ourselves about and to make sure we're aware about. But I would say it's more knowing your risk factor, having the right information, and then acting on it and doing something proactive, in this case, preventative, as in getting the vaccines to help prevent yourself from being a patient that I have to see in the emergency department.
Absolutely. Can you guys hear me? So thank you for that. I think my Zoom is frozen, but I think you can hear me, so I'm going to keep moving on. Dr. Deena, the last question for our moderated discussion I have for you is, we talk a lot about the education that's out there for patients and the resources that are there. What questions do your patients normally have for you that you wish there were more information for?
You know, the questions that come to me are so varied that I think it's very difficult to say that you should go to this one source and get all the information that you need. I do always recommend my patients to look at the CDC website, because I think the information that's available there is very broken down into easy to understand facts. It provides you with the data. If you want to dig in further, it allows you to have that option as well, where it cites the actual studies and the science behind the decisions that are being made. So I think that the CDC is a really great resource. It also has a lot of infographics, which I think makes it a lot easier to follow information that way by looking at a picture to give you the information that you need. I think, again, I think the biggest source of information is a trusted medical resource that is in your life, like a physician or a nurse or someone who really understands the data of COVID-19 and can really steer you in the right direction. That would be the best source of information, I would say. In general, I think a lot of women come to me because they're concerned about fertility issues. And I always recommend then that they go towards the experts of fertility, which falls under the American Academy of OBGYN, or what's called ACOG. And basically they have all of that listed resources out there as well, with fact-based information for every single recommendation that they're making about COVID vaccinations and pregnancy, COVID vaccines not leading to infertility for women, and also not leading to infertility issues for men. That's something that's also come up multiple times. So I always recommend going to the organizations that we trust as physicians to give patients the best information. And oftentimes patients may not know where that information is. So talking to your doctor, that'll really steer you in the right direction. I think the biggest issue is that I have patients that come to me and they'll say, oh, I saw this on TikTok, or I saw this on, Instagram, and so mentioned that they had the COVID vaccine and now they can't have kids, or now they have this issue or that issue. And I think that, yes, that's one personal situation that has maybe been shared, but things can be rare, and not everything is related to a side effect of the COVID vaccination. So I think it's important, again, to bring up the questions you have with your physician. I think that they're the best people that can guide you in terms of what to do and what not to do. And, I'm also available as a resource too. I'm happy to, take any questions or, any worries that you have to help better suit that, because I do think it's extremely important to get vaccinated. I do think that there is, a big discrepancy between people who are getting vaccinated in different areas of the country. And I think that a lot of it is based on misinformation. And I think that we can help you make a better decision to hopefully not get sick and, be able to have a better life for you and for your community.
Absolutely. I completely
Can't hear you.
We
I
lost
think
your
you're on
audio.
mute, Chris. I think you're on mute, Kristen.
Can you hear me now?
Yes. Mhm.
Okay, so I was just saying that's fantastic. I really appreciate all that you said. And it's time for Q&A, so please put your questions in the Q&A box. We do have a couple of pre-submitted questions that I'll go ahead and ask our panelists. The first, is it safe for people with diabetes to get both the flu shot and the COVID-19 booster at the same time? So we know it's booster season, if you will, as well as flu season. So can you speak to that?
Sure. So I think it is safe to get both of them given at the same time. In fact, the CDC is even recommending that if you wanted to get the COVID-19 vaccine, even the initial vaccination and the flu shot at the same time, that would be okay as well. I would say the only people that need to be wary about this are people that have had like severe reactions maybe to the initial COVID vaccination, just because we don't know if they'll have another sort of reaction to the booster. And if they end up getting the flu and the booster, then, they might have to deal with some, side effects potentially that may not necessarily be debilitating, but may not necessarily be something that, they want to face. So, we often recommend Tylenol and such for such situations where people have fevers or they have muscle aches or they just feel generalized fatigue. But I think in general, it's pretty safe for everyone. If you had a significant reaction, you should talk to your doctor about whether or not it's okay to combine.
Yeah, I want to jump in on what Dr. Deena said, and all great points, totally accurate. I would say also, for those who have had some type of reaction that was severe, by definition, and this is not you had a rash or you had some swelling at the site, those are expected reactions from the vaccine. Some people will have that, but a severe true allergic reaction, you should probably talk with your doctor. They may refer you, or more than likely will refer you to an allergist. It does not preclude you getting the vaccine, meaning they will watch you, and there's certain things that they would do that you may still be able to get the vaccine. So I think that's important to note. And in addition, a couple of my colleagues who are allergy immunologists literally just went to a conference, and they've actually found that a good number of people may have an initial reaction, but the second dose did not. They did not have a severe reaction, 1 out of 4. So they were basically pushing about 80% were not having a reaction after they had an initial reaction. So again, the statistics bode well for that. Only 1 out of 4, maybe 25%, a little less, may have had a true severe reaction of those who had an alleged reaction. Just putting those numbers in context. But thank you.
Okay, yeah. So the story is, don't let it scare you. If you're scared, talk to your doctor. All right, the next question. Have you heard of anyone with type 1 getting a breakthrough COVID infection? And what was it like for them?
So I have had patients with type 1 dealing with a breakthrough infection, and I can tell you for the most part, their infection has never been as severe as their initial COVID-19 infection. So we do know that from a lot of data that's been presented to us, suggesting that once you've had the vaccination, the breakthrough infection is typically a less severe form of the disease. So I've had patients with type 1 who've had an infection that may have kept them home from work, or some of them, initially were hospitalized with some of the complications related to type 1 diabetes and having an infection, something that Dr. Dan mentioned called diabetic ketoacidosis. But they actually did not have that in the second breakthrough case. So it's less severe. They're able to stay home. They're not being hospitalized. And because they're protected, they also have the advantage that they're very unlikely to die from that breakthrough infection. So it's safe, it's effective, and I still recommend to make sure that all my patients with type 1 get the booster as well.
Awesome. Thank you, Dr. Deena. Another question probably for you. Have you heard of a pattern of running a stubborn high with insulin resistance before getting sick? And I'm assuming sick with either flu or COVID-19. If so, do you have any recommendations on managing that?
That's a great question. And that's actually something that, I've seen with patients as well. I've seen patients having very high levels of sugars, not very well controlled in the initial phases of their infection. So maybe like a day before they actually become very symptomatic. And then I've seen people continue to have high blood sugar values throughout their course of the illness. And it can last for, up to a week in some cases until their blood sugar starts to come down. The reason for that is because our body secretes a hormone called cortisol, which is a stress hormone in the setting of any type of illness, including an infection like COVID-19, which then leads to more insulin resistance, leading to higher levels of blood glucose. So oftentimes in this circumstance, I would recommend for my patients to call their endocrinologist or their primary, whoever's managing their diabetes, and talk to them about what they should do. Sometimes it can be just simple tweaking of the medications for a short period of time that can actually help to improve their blood glucose levels and get them in a better place. And sometimes it can mean, adding on a medication temporarily to kind of combat the effects of having those high blood sugar values. Sometimes it's just temporary, may only last for a day or two, but if you're worried, you should definitely speak with your doctor about that. The other thing I should mention is that many patients who get admitted for COVID-19 or have COVID-19 infection initially, they may be treated with medications that are called steroids. Steroids are medicines that can actually raise the blood glucose values as well. And so oftentimes when these patients come in the hospital or some of them see me in my office, I oftentimes will change their medications to try to get their blood sugars under control temporarily until that medication called a steroid is worn off. And then, usually they go back to normal. So the good thing is the high blood sugar levels are temporary. They often follow the course of the illness. So the more sick you get, the higher they may be, but they definitely will start coming down, and nothing to fear, but definitely speak to your doctor if you're concerned. This is especially important in my patients with type 1 diabetes because they need higher levels of insulin to be injected when they have these issues.
Okay. I have another question that was pre-submitted, but I want to remind all of our participants to put your questions in the Q&A box. And this last pre-submitted question has to do with monoclonal antibodies. So can you speak to if type 1 and type 2 diabetic patients are eligible for monoclonal antibodies if they are sick with COVID-19, and how do they access them?
You want to take that, Dr. Dan, because you're seeing these patients.
I sure can. Thank you. So yeah, monoclonal antibodies, another one of the cheat codes to COVID, right? It does exist. It does work. Actually, we found it very effective if it started early on in the course, underline that, early on in the course. So within the first few days of the symptoms beginning, if you're able to get in a program, a facility that actually does that, and you can go to www.hhs.gov, that's H as in hotel, hhs.gov, and you can go under monoclonal antibodies, and you can type in your zip code to your area, and it'll show you a list of areas where they have facilities where they are infusing it. It will not be done at a hospital or an emergency department. So they have these alternate care sites or facilities within the community that they've actually pre-positioned that you can get it. Sometimes it's difficult to get access to it, but that's at least a resource that you can try and find out. And it has been effective for type 1, type 2 diabetes. All people who have underlying chronic medical conditions above the age of 12 have been approved. So there are certain criteria you have to meet, but for the most part, if you have the symptoms early on and you need to access that, please make sure you contact your provider. It's not going to be done at an emergency department, so that's not where you're going to go get your monoclonal antibodies. You need to go to hhs.gov, but your physician will probably be able to figure this out, or you can reach out to the local health department who can also give you that information. But great question.
And just to answer the question further, Kristen, you mentioned patients with type 1 diabetes being fearful of the monoclonal antibodies. This is something that's available to them as well. But there's certain criteria that everyone has to meet before they're actually given the therapy. So it's important to talk to your doctor. You can talk to your primary doctor about this. You don't necessarily need to find the information on your own. If you're concerned and you think that you're eligible, you just call up your primary care doctor's office, and then they'll be able to guide you in terms of where you can go. It's often available in what's called these infusion centers. They're places where people go for like cancer, chemotherapy treatments, things that for medications that are given intravenously. So if they're able to access a center like that, it would be advisable. So talk to your doctor to see where the easiest place would be for you. And they'll also be able to sort of screen you first to see whether or not you would be appropriate for that or not.
Absolutely. Thank you both so much for those answers. I appreciate it. I don't see any more questions in the Q&A. So any last thoughts before we wrap up?
Yeah, actually, I have a question for Dr. Deena, which I think will be helpful for the audience. So there are people who actually developed COVID-19 disease and then developed diabetes. Is that true? And what can you tell us about that?
Sure. So that is, so we don't have any data that COVID-19 infection itself causes type 2 diabetes or type 1 diabetes. The thought is that these patients that presented to the hospital, from what I've seen, because I was dealing with a lot of patients who came in with COVID-19 and diabetes, what we saw is that a lot of them were either having pre-diabetes prior to their admission into the hospital when they got COVID-19, or they were people that hadn't seen a doctor in a while, hadn't gotten a test with the hemoglobin A1C, so actually didn't even know that they probably had prediabetes or diabetes predating that admission. So that just echoes the fact that it's really important to consider getting screening for type 2 diabetes. It's a simple blood test called a hemoglobin A1C. If you're concerned about your risk for diabetes, I think that this is the best single test that you can take that will tell you a lot about whether or not you have type 2 diabetes or you're at risk for developing diabetes. The other reason why we saw a lot of patients developing potential diabetes or high blood sugars in the hospital was because they were being given these medications called steroids, things like prednisone or hydrocortisone is the name of these medications, which increases your blood glucose values. And so that in general, they had a stress from the infection, and then they also had a stress from getting this medication, which led to even higher blood glucose values. But some of these patients that we saw in the hospital, once we started treating them and once their infection improved, some of them, may have done well with just an oral medication for their diabetes, and some were doing well with just being diet controlled. So it really varies. So if you did ever get concerned about your glucose values when you do like a blood test, like some people look at fasting glucose values, if you ever had a hemoglobin A1C that was considered borderline or high, if you have prediabetes, those are all reasons to make sure you see your doctor so that you're making sure that your blood sugar levels are controlled, so that in the setting of any type of infection, not just COVID-19, but even influenza virus, for example, you are under control and you're not worried about where your glucose values will go. The other group that I meant to mention also was women with gestational diabetes. So women with gestational diabetes, that's already an increased risk factor for developing diabetes. So we were seeing women coming in with COVID-19 infection. They had gestational diabetes, 5 years prior. They never really followed up with the A1C, or maybe they did, but they didn't do it recently. And now they all of a sudden have diabetes. Well, we know that gestational diabetes is a risk factor for type 2 diabetes. So you need to be followed every year at least with the hemoglobin A1C to make sure that your blood sugars are staying controlled and you're not at a place where an infection might throw you over into type 2 diabetes.
Thank you, Dr. Deena. I have another question, if I may, Kristen.
Absolutely. Go ahead.
Yeah. So also I heard and read some data with regards to actually coronavirus actually attacking the islet cells, or these weird cells in the pancreas. Can you tell us a little bit about that and how that's also related to other viruses that typically, almost like flu, Coxsackie, other types of viruses that we sometimes can see that can affect these cells that help produce insulin in the body and may be related to diabetes? What's your thought on that? Yeah.
So I think that it sort of goes back to what is your risk factor for developing diabetes, right? So if people are already at risk and now you're increasing, people already at risk already have some level of insulin resistance, and now you're adding on the stress of having an infection, and maybe the COVID-19, the virus itself is having some indirect effects on transporters that are even within the kidneys. They believe that there's even a correlation between the virus and its impact on the GLUT2 receptors in the kidneys, as well as some of these cells of the pancreas. There is a potential that it's a perfect storm for why these patients' blood sugars are highly elevated. But the truth is the data there is not conclusive. So we don't have enough data to tell us that, this virus is having these direct impacts on the pancreas, which is why people are having diabetes. I think that if that was the case, we would see hundreds of thousands of people in America who had COVID-19 infection developing diabetes, which we're not seeing. So it's really a group of individuals who are already at high risk, who have now gotten hit from many different ways through the actual infection itself, whether or not that's related to the direct effects on the pancreas and the liver and the kidneys. Then you also have the issue with receiving steroids, then you have the cortisol rise. There's multifactorial, this issue is like multifactorial in terms of why their blood sugar levels are going high. So, it's a theoretical point, but we just don't have conclusive data to support it. There's also some thought about medications, if that was going to be your next question. There are certain medications as well, even, including metformin, including lisinopril, which a lot of our patients are taking. There was a thought that lisinopril, which is a blood pressure medication that many of patients with diabetes is on. Lisinopril is called an ACE inhibitor. That's the category of medication that it falls under. And an ACE inhibitor, which can help protect the kidneys, but also can help optimize blood pressure, is a very common drug with many patients with type 2 diabetes. And there was a thought that maybe lisinopril or an ACE inhibitor in general may be predisposing some of these COVID-19 patients to developing worsening diabetes. And again, that data is not conclusive data. And in fact, when patients were in the hospital, when they were taking ACE inhibitors, we continued ACE inhibitor therapy even when they had a COVID-19 infection, because we didn't see a true link between that medication and their infections.
So, Dr. Deena, I didn't know you were a mind reader also, so that's great.
Okay.
That's fantastic.
So I think from my perspective as a last statement, I would just really want to, echo what we've been talking about, the slides that Kristen shared with us that are extremely important. And the bottom line is you need to get vaccinated. There's really a lot of data to suggest that vaccines are safe, vaccines are effective, and vaccines can potentially save your life. So to protect yourself against the flu, to protect yourself against COVID-19 this season would be the best thing that you can do for yourself and for the community, especially if you have diabetes. We know that any type of infection puts patients with diabetes at risk of having severe complications of that infection, leading to problems with their kidney, leading to need for intubation in the hospital, leading to complications and such. And if this is something you can prevent with a vaccination that we know is safe and effective, that's something that you should definitely consider. And if you're worried about it for some reason, talk to your doctor about what your concerns are and move forward from there, because that is the best thing that you can do for yourself and your family. We know that the flu season is going to be very rough this year because we have all been home last year. Now everyone's out and about once again. Places don't necessarily have mask mandates any longer. So it's important to really think about your community, who you're around, and to protect yourself and to protect others. So if you are high risk, and you're living in a hot spot where there's a significant number of COVID cases around you, make sure you're protecting yourself, wearing a mask, hand washing, all those social distancing measures that we've been doing for such a long time. You need to continue. This is not a time to forget that we're in a pandemic.
Thank you for saying that. We are still in the throes of a pandemic, guys.
Yes.
Please keep your masks on, get vaccinated, wash your hands, all of those safety measures, physical and social distancing. Before we head out and close, I just wanted to share with everyone that our Drive Diabetes Toolkit was released this month during Diabetes Awareness Month. Our Drive program has 3 toolkits: a flu vaccination, COVID-19 health outcomes and vaccinations, and now diabetes. It is basically quality improvement and clinical education in an online form that clinicians are easily able to access and implement in their practices. And so if you go to shcdrive.org, you can access it and email us if you have any questions or if you need any help implementing your project. And I want to thank you all. Thank you so much for joining us. Thank you, Dr. Deena, Dr. Dan. It was a pleasure, and you all have wonderful evenings.
Thank you.
Bye.
That's the help.
Bye.